When disaster strikes, it's a test of life and death, where people are tested. Leaders are tested.
Not to panic and face it unitedly.
Institutions are tested.
I never thought that I would have to face a crisis of this magnitude. That night I couldn't sleep at all.
It brings out the hero hidden somewhere within us.
जो भी situation है, 108 always ready to provide service for people.
Lessons are obviously learned.
2013 has tested us once again as to where we are good and where we could be better.
Ultimately, a disaster is a test of the human spirit. And this film is about the triumph of that spirit. October 8th, 2013. The Indian Meteorological Department reports a depression in the Bay of Bengal. In the next 24 hours, the system intensifies into a deadly cyclone, heading straight towards the coast of Odisha. The state is bracing itself for the fury of phailin. The Odisha government has just 72 hours to act. In 3 days, the monstrous cyclone will hit the Gopalpur coast, battering it with winds raging at 220 kilometers per hour. 1,32 lakh people spread across 18 districts of Odisha will be affected. 2,09,256 houses will be damaged. But the place which is in the eye of the storm is Ganjam district. By now, the Navy, the Army and the Air Force is put on standby. The 3 days before phailin makes landfall are critical. While the state machinery works behind closed doors to take on the cyclone, the Chief Minister of Odisha instills confidence in his people, asking for calm and restraint.
I request you not to panic over the situation and face it unitedly. The state government has taken all necessary steps to face the situation with promptness.
The Chief Minister himself heads the disaster management meetings, and they come out with a one-point mission statement that there should be zero casualty. It is a tough, almost impossible mission, but all departments of the Odisha government are pressed into action.
This is the difficult part.
Unfortunately, phailin strikes during Durga Puja, Odisha's biggest festival. The officials know that festivities can wait for another year. Today, they are needed on the ground 24/7. So no one complains when the Durga Puja holidays are cancelled. They all stand by their Chief Minister. But one department that was going to be tested to its limit was the State Health Department.
In the Health Department, we took some advanced steps. Initially, I called all the directors with emphasis on public health, general health care system. So we made a massive program.
October 12th, 9 p.m. Cyclone phailin makes a landfall near Gopalpur coast in Ganjam district. All the planning and preparation was soon going to be put to the ultimate test. 10 p.m. Oima Center, Bhubaneswar. The Odisha Emergency Medical Ambulance Service Center in Bhubaneswar is tackling one of its toughest days. Just an hour into the cyclone,
will have close to 20,000 calls.
And it's already getting double the number of emergency calls for its 108 ambulance service. One such call is from the family of a pregnant woman. Kamini's family is calling from Ganjam, which is in the heart of phailin fury.
सर आपन सेठी केमती अछि क्लाइमेट केमती अछि
Now it's up to Rajiv, the emergency medical technician, the ambulance driver and the medical attendant to react. They decide to reach out to the pregnant lady. They brave the cyclone. Taking phailin head on, they reach Kamini Das in time.
हमने ओडे डाकला केले पवन छात्रे नाय कहले कोन सिनु कहले आसी नी कहले कहला गु आथरे आशा पाखु गलु आशा ले कहले कि 108 गाड़ी फोन करो फोन करले आसी.
She is rushed to the ambulance. The wind speed worsens and so does Kamini's labor pain. Rajiv and his associates now have a difficult decision to make. There's no more time left. So they decide to help Kamini deliver the baby in the ambulance itself. What helps is that Rajiv and his associates are trained for such emergencies. Finally, with their support, Kamini delivers a baby boy. Life triumphs in the time of destruction, and they decide to name the baby phailin.
पहले हम 36 प्रेग्नेंट लेडी को हमने ट्रांसफ़र किया, देन मोर देन 150 पीपल को रिलीफ कैंप को हमने लाया. तो जो भी हालत है, जो भी सिचुएशन है, 108 ऑलवेज रेडी टू प्रोवाइड सर्विस फॉर पीपल.
Phailin brings out the hero in many ordinary people. Asha Karmi, Ras Sethi, faces a similar dilemma like Rajiv. As the storm rages outside, it's up to her to help a young mother deliver her twins.
टेम्पो खोजती पु गोटे आड़े आशा गोटे आड़े मु घर रही मैं कौन कर झील से आ तुम टेम्पो डाक जाइच आ टेम्पो आइला जे रही.
Though trained for such a situation, today it's time to take an extraordinary decision. What helps are her years of hands-on experience.
आशा दे देथिले मसाज कर पाली नइले मसाज कर पाली.
Personal commitments apart,
361,000 people have been evacuated right now.
what really helps is the decision of the Odisha Health Department to shift thousands of expecting mothers to safe houses and health centers. They scientifically target women who had their expected date of deliveries very close to the cyclone period.
All mothers were contacted individually over telephone or through ASHAs or through field workers, and we ensured that all of them reach at least the public health institutions or a safe place nearest to the delivery point from where we could transport them by deliveries by providing mobility support.
In the intervening night of 12th and 13th October, as phailin lashes Odisha, babies are safely delivered at several affected hospitals and health camps, thanks to the immaculate planning. Here at Barampur's City Hospital, 8 babies are born. Though the hospital is badly damaged and the conditions are tough, the only thing that keeps the staff going is team spirit. To tackle the aftermath of phailin, disaster response teams are formed at state, district, block and even panchayat level. The aim is to reach out to every single affected person. October. Within 24 hours of the cyclone, it becomes obvious that the impeccable planning has worked. Not a single case of death is reported due to lack of medical facility.
The state administration was so supportive that we didn't feel that we are alone at Ganjam.
The coordinated effort and teamwork has worked wonders. The mission statement of zero casualty has been almost achieved. A simple comparison gives a clear idea of Odisha government's phenomenal achievement. The 1999 super cyclone that struck Odisha coast killed more than 10,000 people. Hurricane Katrina that hit the United States in August 2005 killed as many as 1,800 people. Less than a month after phailin, super typhoon Haiyan struck Philippines, killing over 4,400 people. The death toll of phailin, believe it or not, is just 21. But this low casualty is no reason to be complacent for the team that has worked so hard to save lives. Nature's fury was not over yet. Incessant rain for 5 days immediately after the cyclone badly affects 13 districts including Ganjam, Balasore and Mayurbhanj. Soon, heavy floods hit these areas, not once but twice, killing 40 people.
In this entire 18 district, 13 of them there was a repeat disaster. We have around 539 health institutions were affected. Every day morning you look at the sky and it's still raining for 6 continuous days. Nobody had seen so much of rain. So everybody was little bit mentally exhausted.
This video was shot on a mobile phone by a hospital staff of the Mayurbhanj district headquarter hospital just few hours after flood waters entered the hospital on 13th October. As the flood water gushes through the ground floor, doctors and staff shift 150 patients from the flooded floor to the first floor within no time.
Doctor mane ठीक time को आसी हमको साहाय्य करले एवं nurse दीदी माने भी हमको आसी करी help करिसंती बहुत.
Extraordinary situations call for extraordinary measures. A temporary labor room is set up on the first floor, and 9 babies are delivered under extreme circumstances. Soon the generator gets submerged and the power backup in the hospital fails. As the hospital plunges into darkness, candles are lit. What shines through is the hope and commitment.
23 children were there in the SNCU of Mayurbhanj DHH, and there was water everywhere. The DHH could not be approached at all. All infrastructure breakdown had happened in Baripada town, and there was a 5-hour to 6-hour rescue operation which had to be taken so as to shift the 23 infants to a safe location. I would say those 5-6 hours that we spent for the rescue operation on 13th night was certainly one of my most momentous occasions.
As the flood waters recede, the real test of the health department is about to begin. The threat of outbreak of disease after such a huge disaster is quite real. The department had of course prepared for such an eventuality. To prevent an epidemic, the health department relies heavily on thousands of ground-level health workers and the Asha Karmis. The Asha Karmis go from door to door, reaching out to almost every household in the cyclone and flooded areas. They sensitize people, explaining how personal and community hygiene and use of disinfectant can prevent epidemic. At the same time, massive immunization programs are carried out, almost setting a record of sorts.
We are targeting to cover around 18 lakhs children within the age of 5 years in a target period of 10 days. This is the largest ever measles campaign taken in the state ever since the initiation.
Health department has a very important task to perform. I think they did a great job in that. Everyone has worked together as a team, and because of the team efforts, a major tragedy could be avoided. because we already had, as they say, Mahabatya, we had Mahabanya, now we don't want any Mahamari here.
Mahabatya or Mahabanya, the Odisha government took on the forces of nature head-on and emerged triumphant. Through it all, the government machinery is marshalled by the Chief Secretary of the state. He works silently, behind the scenes, like an army general, strategizing on how to take on the enemy at every step, and emerges victorious with his team.
The accurate weather forecasting from the IMD was a big help in this matter. As soon as we got the cyclone alerts, we could use the mass media very effectively to reach out to the people in the affected area. Over the last 14 years, in the aftermath of the 1999 super cyclone, the Odisha government has built up the disaster management capacity in a substantial manner. So that actually was a big, and all the capacity that we have built up over the years were actually tested this time round. The team work that we saw, right from the state secretariat up to the village level, to the panchayat level, to the district level, that was a very great lesson for all of us.
Our primary responsibility was to protect the valuable lives of our citizens. I think we have been successful in minimizing the loss of precious lives. Normalcy will come back soon. I'm sure with your active support, this should also be possible.